Choking is a condition in which something gets stuck in the throat of the child so that he is not able to breathe at all. Choking, it's an emergency. You need to act as quickly as possible to make him breathe as early as possible. So in this video, we'll see what to do and how to do the maneuvers to dislodge the object which is stuck in the airways, which is not making him able to breathe. Hi, I'm Dr Meenakshi Verma, Pediatrician, Sparsh Clinic, Panchkula. Welcome to our channel. When a child is choking, you can find him in two types of states. One is a partial choking and the other is complete choking. How will you come to know that the child is in a state of complete choking? So these are the signs which you must see in the child, that he is not able to cry, speak or cough. You will find that he is keeping his hands over his throat like this. His face and lips are turning blue. He also might be making a high-pitched noise out of the efforts to breathe. So, if you find your child having two or more of these signs, you should act immediately. What is to be done in a case of complete choking? Yes, obviously you need to rush to the hospital, and the maneuver which I am going to show you can also be done on the way to the hospital. So let's see what is to be done in a child who is less than 1 year of age and in a child who is more than 1 year of age. So let's watch it out. Support the head and neck of the baby in your hand and place the baby's face and head down on your forearm. Baby's head should be lower than his body. At a point in between the two shoulder blades, give 5 back blows with the heel of other hand. If the object comes out, well and good, but if not, turn the baby over, place his face up on your forearm, head being lower than the rest of the body. With your two fingers, ring finger and middle finger, and in the middle of the breastbone, give 5 quick chest thrusts in the downward and inward direction. Repeat 5 back blows and 5 chest thrusts until the object is coughed out or until the baby is able to breathe, following which he needs to reach the emergency and attended by the doctors. But if there is no response after 5 cycles of back blows and chest thrusts, place the baby on a table face up, lift his jaw and tongue like this. This is called jaw lift. Jaw lift draws the tongue away from the back of throat and helps opening up the airway. Try to look out for the object inside his throat. If you can see it, swipe it out by your finger gently without any panic. Avoid poking your finger blindly straight into the throat. You must do a finger sweep only and only if you actually see the object. Otherwise, start mouth breathing right away. Tilt his head back and give 2 slow breaths into his mouth from your own mouth. Watch for his chest rise. If breathing resumes, that means the blockage has been relieved and you can now take him to the doctor. But if still he is not breathing, repeat these 2 rescue mouth breaths. Again watch for the chest rise. If yes, take him to the doctor. If no, repeat 5 back blows and 5 chest thrusts. Then again jaw lift and looking out for the object and sweeping it out if visible. Keep repeating these steps until the object is coughed out or until the breathing resumes. And in a child who is more than 1 year of age, you need to do this maneuver. Watch it out. For a child more than 1 year of age, we give abdominal thrusts, which is called Heimlich's maneuver. Stand behind the child, make a fist like this with one hand and place it between his ribs and navel. Grasp the fist with your other hand and give 5 quick upward thrusts until the object is coughed out or until the child is able to breathe. But if neither of the two happens, place the child on a table, do jaw lift as we did of the baby, look out for the object inside the throat and sweep it out if it's visible. But if it's not visible and the child is not breathing, give her mouth breathing after tilting the head back. Watch for chest rise. If it's rising, that means breathing is resumed. Nothing more to do. Take her to the doctor. But if chest doesn't rise, perform abdominal thrusts again in lying down position. Give 5 upward thrusts till the object is coughed out or you can see the object and sweep it out. Keep the above steps repeating until you succeed in dislodging the object or in resuming the breathing or until you reach the hospital emergency. The other important thing here is, even if you have succeeded in dislodging the object from his throat, you still need to visit the doctor because some portion of the object or the food particle might be remaining in his airways, so that's need to be taken care of. In partial choking, what will you find is that the child is able to speak or able to cry or able to cough out and he is able to breathe. So what precaution you need to take, that you should not try to remove the object with your finger blindly. It may convert this partial choking into complete choking because it can push the object further away into his airways. It's only if you see it, you need to swipe it out with your finger. You just need to rush to the hospital and the child should be taken care of by the hospital staff and the doctors. So that's all for today. I hope, God forbid, if your child needs help because of choking, you will now be able to act immediately to save him from upcoming dangers. Thank you for watching.